Guam Memorial Hospital Administrator Lillian Posadas received the report on Monday that a couple of GMH doctors returned from India and over the weekend were experiencing COVID symptoms. Posadas tells KUAM the doctors arrived on island on April 17th, right before India's surge as the Middle Eastern country's COVID crisis continues to deepen. The doctors, however, were given quarantine exemptions as Posadas says they had negative PCR tests upon arrival that were accepted. She confirms that the doctors were cleared and responding to a handful of patients, including a COVID patient seen by one of the doctors. Public health officials have said that someone exposed to the virus can test negative if tested too soon after exposure. Both doctors, after experiencing COVID symptoms, underwent an Abbott ID test and were positive for COVID-19. They are currently in isolation.
We want to also make sure that the PCR, because that's basically the confirmatory test, if those PCR tests come back negative, then that gives us that assurance that they're free of the infection.
While GMH awaits confirmatory PCR test results, Posadas says the hospital is re-examining their protocols as this does draw major concerns for our lone public hospital designated for COVID response.
Sure, absolutely, there's concern, but everybody again continues to wear the protective gear, and so with contact tracing, our infection control and employee health are following through with the contact tracing.
KUAM reached out to Public Health PIO Janela Carrera for an update on their contact tracing efforts and any potential exposures. As of news time, we have not received a response. And we should note the COVID-19 hospitalization census has increased to 5 patients. There are no COVID patients in the intensive care unit or on ventilator support.